Good morning, everyone. I would like to welcome our upcoming speaker, Professor Majed, Jeraisy, a pediatric clinical pharmacy consultant. Research and education at the Saudi NIH. Prof. Majed have published numerous peer-reviewed articles in highly reputable journals. Please welcome Prof. Majed.
يعطيك العافية، شكرا جزيلا. السلام عليكم ورحمة الله، صباحكم الله بالخير جميعا. I'd like to thank the organizing committee for the invitation. It's a pleasure to be here after this new assignment and appointment to continue my journey in research with the support of all institutions. Without further ado, my talk is going to be about the translational research and the role of Saudi NIH. And before we move into this, just to remind you about the mandates of the Saudi NIH, according to the Council of Ministers in August 2023, it was the Saudi NIH was mandated to support and facilitate translational research and clinical trials conduction in the kingdom. Now, a lot of people, they have some confusion or sometimes overlapping with what is translational research. Is it different from clinical trials? Why it is separate? What do we mean by translational research? Is this something that we have to look for? And how can we reach that? How can we be included in the funds support from the Saudi NIH? And we will try to first define the translational research and then go further on the strategy of the Saudi NIH for the translation research. But this is important to keep in mind that the mandate of the Saudi NIH is related to health research. So this is excluding all type of research outside the health. So anything related to health science, it is going to be included in the support, in the funds, in all kind of arrangement, building the infrastructure, the ecosystem. It is going to be one of the functions of the Saudi NIH. So when we say translational research, what does include in the definition? So basically, translational research is a research that works to transfer knowledge and discoveries that was come out from the basic science into stage of application in clinical practice and community. So whatever it goes or it come out from discovery from the basic science health research, this is considered as a stage one. Moving into the application of clinical practice community, this is stage two. To improve, of course, health, human health through development of medicines, technologies, and new methods of healthcare. So this is going in the arena of the biotechnology, if we are talking about the technology and new methods of healthcare. In brief, or in another language, so if we say translation, usually in the context of language, translation from language to language, it's the same thing. So translation from a language of basic science into a language of applied research. This is the basic definition of translation research. Now, with this being said and considered, the Saudi NIH position in translation research and clinical trials in the value chain is included in 5 tiers, okay? And starting from the tier 0, from the early discovery, defining mechanisms, basic science, moving into the tier 1, which is the first translation into humans, which has come into first in human and phase 1 clinical trial, moving forward to the tier 2, which is now we move to patients. So when we move from the discovery to apply to patients, starting or with the aim of proving the safety and effectiveness of this novel medication, novel technology, new discovery. This is in phase 2 and 3. Continue moving to T3. Tier 3 is the translation to practice. This is where the area of confusion sometimes happen. This is something that we have to keep in mind and consider. Developing evidence-based guidelines. This is translational research. So it is not only يعني محصورة في basic science and clinical trials. No, even this is considered as translational research. Just to broaden the scope of support and the funds of Saudi NIH for translational research, this is included. But it has to be with impact on economy, impact on improving the healthcare through developing new protocols, guidelines, and this is included in phase 4. Trials, disseminating information, collecting or building database and registries for the sake or the benefit of having a plan to collect the economic impact or the burden of diseases. And the last tiers is about the translation to communities, which is really another very important, significant impact on our country. So whatever fall into this category, studying the impact on health outcome and economic, including population-based outcomes, cost effectiveness, pharmacoeconomics, all these are considered in the tier 4. So with this in mind, having all tiers, this is where the translational research become and fall into these categories. Now, the Saudi NIH oversees the translation research and clinical trials with the aim of transforming the kingdom into different functions. And these functions, I'm sorry to just read the list, but it is important to mention it one by one because I think it is something to keep in mind. So focusing on urgent national health priorities, translating knowledge output into products, localization and provision of experimental medicine based on clinical trials, empowering national pharmaceutical, medical devices and biotechnology companies to develop innovative products, bridging the gap between basic science output and their application in clinical practice, reducing disease incidence and healthcare costs, supporting national health security, attracting investment from global medicine companies and increasing returns from research funding, educating, training human capitals in clinical research activities, and last but not least, creating an integrated ecosystem with RDI and all other stakeholders related to research. So if you can see this is a very broad functions of Saudi NIH, and we are capable of building the ecosystem to build them. The most important thing is to avoid the overlapping and duplication of resources and efforts that everybody is working on. So we are trying to have the alignment of these functions with the stakeholders that involve in research, such as the RDIA and other healthcare institutions. KMARC is one of the leading institutions in research. I'm sure you have seen this before. Was presented by Prof. Faris in one of the meetings, but this is the strategy house of the Saudi NIH. It was built on 4 pillars, okay? First one, 4 pillars and also well-defined strategic goals. So these 4 pillars included here, enhancing clinical trials, funding translational research, transforming health research outcomes into economic impact, and enhancing the research environment, or empowerment, I mean. So because our focus is going to be on translational research, so we'll be focusing only on the mandate of the translational research in this talk. So speaking about the funding of translational research, so what do we mean by funding? What type of funding that we are providing at the Saudi NIH? So if we are thinking about the main objective of this pillar, identifying priority area and programs for human health and strategic planning to support the implementation of translational research and clinical trials, ensuring effective funding. So this is important. To start with is the research priorities, and this is what we are working on, which I'm going to present in a few minutes. So with the strategic goal, we have developed strategic goals, strategic KPIs, and operational KPIs under this category, which is important. Just to mention the strategic impact on this over 5 years period, when we are developing our research priorities and programs, what we are aiming at is to start with implementing, activating these programs, because it is a lot of programs. We'll mention it in a few minutes. But we are not aiming to activate all these programs at once. So to be realistic, we have to be focused, we have to be concise, and we have to look for a quality and high impact. So starting with implementing and activating 20% of these programs, moving forward to 20% each year until the year 2029, hopefully reaching the 100% of activating all research priorities that we are working on. Now, in order to build the research priorities and these programs, it is important to consider all the, sorry I didn't bring that slide, talking about how did we come up with the research programs. Of course, we have to consider all the entities involved in identifying these programs, entities, governmental sectors, institutions, other health authorities, and also research authorities. So all these have been considered in developing these programs and using or utilizing the approach of the situation analysis, challenges, question, and then come to the zone 2, which with the answers. This is what was the strategy to develop these 13 programs. So speaking about in zone 2, and I'm going to focus only on number 4 here, is when we have developed these programs, these 13 programs, we have, of course, come up with the flow of the journey in the research program. So we have to have a strategic plan on how we are going to activate these programs in a timely manner. Okay, so this is something important for the success. And what we did in order to do this is we developed a research council. With the research council, appointing a team leader under each research council. This team leaders have already compiled or selected members of the council, and they start now meeting to develop the priorities under each program. Whether we start from the top-down or bottom-up approach, either one, and I think it's okay to use the approach of both, starting from the decision makers, go to the down or bottom, or start from the bottom, who are probably the researcher or people working in the research field, and going up to the decision makers. Both ways are helpful and doable. And the last thing is having, we start with a model of research programs, and then we continue on these models and applying it to other programs. So one of the important, I think, aspects of the funding these programs, we have to develop a mechanism of funding in order to be fair and to have a fair distribution between these programs in different ways. It's not only supporting these programs for clinical trials, but it has to be in different ways, keeping in mind the concept of translation. So these mechanisms include translation from bench to bed, translation to market, translation to practice, and empower translation capabilities. So under each funding mechanism, again, we have allocated a percentage of funds under each one, each category. So when they are applying for research funds, we have to look at which mechanism that falls under. So if we say, for instance, translation from bench to bed, so we are talking about a basic science research that going to have a proof of concept research, so it is accepted, or going forward to the preclinical studies, moving forward into probably a phase 1 clinical trial. And then translation to market, which include phase 2, phase 3 studies, or it could be non-clinical, but in the stage of development. It could be also translation to practice, as we mentioned, or it could be empowering the translation capabilities, which means there are so many categories under translation or empowering capabilities. Many examples here, infrastructure, fellowship, career development, conferences even, training programs, these are all building capabilities and empowering capabilities, translation capabilities, moving forward to support the health translation research and clinical trials. My last slide is this one, and I'm going to spend some time on it because this is the probably important slide that I have. I hope it is clear. But these are the programs that we have developed, and this is the approach that we have used, in fact, to come up with these programs. So considering the translation, the funding mechanism that I mentioned, the 4 mechanisms that we have established, moving forward to the focus area, identifying focus area from national strategies and programs. It took us a lot of time, in fact, to come up with these programs, because we have to consider, as I mentioned, all the stakeholders involved in research, involved in health impact, involved in healthcare. So when we are trying to collect the information from the stakeholders, we come up with these focus areas. This is really important to make the alignment with the stakeholders. So we are talking about health and digital sections here, burden of disease, Hajj and Umrah, vaccine, national security, localization, pharmaceutical localization, and so on and so forth. So these are the focus areas that we come up with. And then the last stage that we have identified 13 research programs, and these are the priorities. These are the 13 priorities, research priorities that we are going to fund and support. So what are these priorities? In fact, you will realize that it covers all type of diseases. But it's not only the topic of the disease. It is cancer program, eye research. So you can imagine also ophthalmology research is considered, where probably in the past nobody is thinking about ophthalmology research or why we need to support and fund translation or ophthalmology research, but it is included. You cannot imagine the impact of this when we are developing this program. And we have also, of course, heart and lung disease, metabolic. It's not really, dental is one of them also. Mental health is important, research programs, neurological sciences, allergy, immunology. Thank you very much. Cannot see the rest. I don't know why reproductive child health research. Thank you. And we mentioned the mental health. We mentioned the diabetes and digestive. So it covers all area, and also the population health, of course, is important. So all these areas are considered. So someone might ask, what did you lift with? What are the areas that you didn't cover? We cover all areas. However, when we have identified the team leaders and developed the council in each program, the council is going to come up with what are the top priorities in each domain. So, for instance, if we are talking about diabetes, we are not thinking of diabetes as a general disease and just thinking of collecting data, see the burden of disease and the complications and how many people. We know all of this. We know the prevalence of the disease is coming this year to reach 35%. We know all the impact of this disease on the community, on the health economic. But we are not looking for this. So by having the council, the experts, to come up with what are the focus area is going to be covered under this research, and then we can take this research activate 20% of these programs in the first year, which is going to be this year, 2025. And please mark your calendar, especially the active researcher. The third quarter, inshallah, of this year is going to be announced for the second cycle, focusing on 20%. We did not identify 20% yet of these programs, but it's going to be announced. And we will have more details on these programs. So this is what we are looking for. This is what we are now embarking on. As soon we are going to announce these programs. Probably we are thinking of end of March to be announced, and so we can prepare people to prepare their proposals for submission. So with this, I would like to conclude my presentation, and thank you very much.